Scientists around the world are preparing for disease X, a pandemic that could be 20 times more deadly than the coronavirus.
Hello and welcome to The Nexus. Today we're taking a close look at disease X. It doesn't exist yet, but scientists want to prepare for it so that if there is an outbreak, they may be able to save millions of lives. Now, perhaps we should all be relieved, but some are worried that scientists might inadvertently cause a pandemic. If that sounds far-fetched, bear in mind that some experts are now convinced the coronavirus came from a laboratory in China.
It is not a conspiracy theory. It is one of two possible mechanisms by which the virus might have reached a human population. It is absolutely not a conspiracy theory.
We'll be hearing more from Milton Leitenberg a little later in the show, but first, let's take a closer look at disease X.
Disease X is a term which is used by the World Health Organization.
Disease X, a hypothetical illness, one that has not happened and is currently unknown.
The next pandemic is already on the way, as UK chiefs warn disease X could kill 50 million people.
Disease X, it's attracting a lot of attention, but it's not a new idea. The first time we used the terminology was in 2018. We were preparing for COVID-like disease. You may even call COVID as the first disease X. And it may happen again.
When you're talking about preparing for the unknown, we concentrate more on developing and perfecting platform technology. Vaccine platforms that are not against pathogen X, but that can be readily adapted to pathogen X.
We can get on top of any epidemic, but the most important thing is public engagement.
You need the data. You need to know who's been vaccinated and who hasn't been. There'll be multiple shots. So you've got to have, for reasons to do with the healthcare more generally, but certainly for a pandemic or for vaccines, you've got to have a proper digital infrastructure.
So there he is, there's Tony Blair. He wants us to have multiple shots and for all of it to be digitised so the state knows exactly what our status is. Pure evil.
The British government has unveiled a new vaccine research facility where scientists are working to prevent future pandemics.
Scientists are trying to find a vaccine that they could develop and produce in 100 days if disease X, the next pandemic virus, came along.
Chinese scientists are experimenting with a mutant COVID-19 strain that when used on humanized mice, it means that they change the immune systems to more closely approximate our own.
They took a virus from the pangolin and they cultured it in cells in the laboratory. And they then infected mice with it, and it killed all of the mice.
Why don't we leave these pangolins alone? You know, like, as you said, this gain of function research is very dangerous.
Do you want new potential lab leaks? Shouldn't we wait to the end of the COVID inquiry to see how this problem began?
Working with these viruses with unknown pandemic potential, you don't know what symptoms they cause, you don't work with them at the highest biosafety level, and there's no way to track incidents of exposure. And someone just walks out in the middle of the city and boom.
Laboratories today are working to make viruses even more deadly than COVID-19. Little is being done to stop them. Why?
In a moment, we'll be talking to two scientists about the preparations for disease X, but first, let's hear from the general public and see how much they know.
Have you heard of disease X, and what could you tell me about it?
Well, I don't know anything about it.
Should the world prepare for future pandemics?
Listen, good luck with that. Listen, you'll be all right. Yeah. You'll live, don't worry.
We should absolutely prepare, and we should get someone that can do it better than the bloody Conservatives did.
The coronavirus showed us that the global trade is so heavily intertwined that we're more vulnerable than ever to things like outbreaks.
Is something else going to come back and hit us that we're not prepared for? How do we deal with it this time?
I don't really know what the outcome would be, but it strikes me as a bit of a fool's game to play around with something that is already very, very dangerous.
It's got to be done differently, and especially where the government is partying and everyone else is locked up.
Ironically, a lot of conspiracy theories around it, and I've seen a lot of scientists trying to debunk things and put information out.
And that is what we're trying to do here at the Nexus. And today we are joined by Dr Amesh Adalja, a senior scholar at the Johns Hopkins Centre, and Dr Simon Wain-Hobson, Emeritus Professor of Virology at the Pasteur Institute in Paris. Welcome to both of you. Amesh, there are a wide variety of efforts being made to prepare for the next pandemic, including the manipulation of viruses in the laboratory, what some people term gain-of-function research. And this is what worries a lot of people we've found. Does it worry you?
It does worry me when that type of research is not being done at the appropriate biosafety level, or when it's being done without any idea of what type of value that research is going to provide to make the human race or human species more resilient to pandemic threats. The thing is that we do face many pandemic threats, and it is important to prepare.
The gain-of-function research, as I understand it, is aimed at finding treatments and vaccines ahead of time, which will help very much if a pandemic does break out. Has it ever borne fruit?
It hasn't borne fruit in the sense of finding a new vaccine or finding a new antiviral, but we have seen some added knowledge. For example, the mutations that a bird flu virus might need to acquire to become mammalian adapted, and that can then be used to look, for example, at bird flu viruses being isolated from seals or polar bears to see, is there mammalian adaptation going on? So it does provide some value. It's something that's part of the whole kind of portfolio of research that needs to be done on pandemic threat agents. But again, it's one that has to be done a little bit more carefully and a little bit more mindfully than other types of research.
Can I refer you to a particular study that's going on in China, where scientists have introduced a virus from a pangolin into humanized mice, causing them all to die. That story made headlines very recently. We have heard from Professor Francois Balloux, an infectious disease expert at UCL. He says it's a terrible study, scientifically totally pointless, and I could see how it might go wrong. That's quite worrying.
Yeah, anytime you're seeing a highly virulent organism being worked with in a laboratory setting, it always has to be done in a safe manner. You always worry about laboratory escape or something happening that's unexpected. And that's why when you're doing experiments like this, you have to be thinking with foresight, what actual value are you getting from this experiment? And in this case, with this Chinese pangolin coronavirus, it's unclear, first of all, whether this was actually gain of function or where it falls on that line, because this was a naturally occurring virus that they put into a special mouse model and got very drastic results with. I don't know what that means for human health, and there's been a lot of sensationalistic headlines, and I think this is something that we need to discuss and parse through. But in general, this type of research is going to be done. It's very important that we set up societal norms for how it's done. And importantly, in that paper from China, they don't actually talk about the biosafety levels, which is the main concern there, rather than the actual results of the experiment, is what level of biosafety were they using.
Simon, when you take a look at this study, do you think it does meet the threshold to call it gain of function, and are you concerned about it?
The pangolin study, I think it's been blown out completely out of proportion. I get the impression that the people who've been talking about it don't understand it. It's good virology, but it's going to tell us nothing about the next pandemic, disease X. It's one of these papers which is, we would say, good to have in basic virology levels, but it's not going to help us much. But it's been blown up out of proportion. And I even heard someone accusing the Chinese of saying this was part of their biological weapons program, which I think is pure nonsense.
The media has picked up on something that has come out directly from the Chinese researchers involved in that study. Scanning through the paper, they found this phrase. This is the first report showing that a SARS-CoV-2 related pangolin coronavirus can cause 100% mortality in HACE2 mice, suggesting a risk for that virus to spill over into humans. Does that mean that they have manipulated the virus and that it could, if it did escape from the laboratory, somehow infect humans?
This is not gain of function virology. They were looking at something that nature threw up. They found it in a cultured virus. And immediately when you find something like a mutant that comes from a lab virus, you say, well, fine, but is that physiologically relevant? Does that mean something? Will this come up in the real world? We have no idea whatsoever.
Amesh, one of Dr. Simon Wain-Hobson's acquaintances, shall we put it that way, Milton Leitenberg, a very established and highly regarded biological weapons scientist, has pointed us to the fact that there are new documents obtained by a Freedom of Information request that reveals that the genome of COVID was very suspiciously close to that of the virus described in a 2018 research proposal from US scientists. And what he's inferring from that is that the proposal came first. They proposed to make alterations to it in a very particular way, and then came the outbreak of a virus that looked just like it. And that essentially, that is the smoking gun that proves that COVID-19 did originate in the Wuhan Institute of Virology laboratory.
So I think there's a lot to say about that, and I don't know that we know anything because the Chinese government has not been transparent about what type of research was going on at the Wuhan Institute of Virology, what level of biosafety was going on. And yes, there was a proposal that was aiming to manipulate coronaviruses from bats and in a way that looks like SARS-CoV-2. We don't know if that experiment was ever done. We know that they had proposed it. We know that the US government says it wasn't funded, but did they fund it internally? And I think this is one of the questions that we have. And I don't know that, again, that we get this answer unless there's transparency from the Chinese government, which has not been transparent about this. But this is the type of concern that people have and why the lab leak hypothesis still has there's some plausibility to it. And I think what we need is the Chinese government to be clear about what was going on in there, in that laboratory, be clear about the earliest cases of SARS-CoV-2, and understand which viruses that they had in their possession. But
Right.
these are all really big asks from for the Chinese government, and they've never had any inclination to divulge it.
Simon, a biosafety professor, Richard Ebright, says that and this is slightly jargonistic, but nevertheless, an order line from BSM-BL in a draft of EcoHealth's 2018 proposal is the equivalent of a smoking gun. In other words, those changes that we've talked about to the virus that were made, essentially it means that the study came first and then came the leak of the virus, which they essentially designed.
Hamish came up with this very important point. We as scientists, we need information, and therefore when we ask a question what was going on, we would expect our scientific colleagues there to help us, and this has not been forthcoming. So this is extremely frustrating, and we're all trying to guess, and some people say it's a smoking gun. I think smoke meaning fire, but exactly what, we just don't know, and we would just ask a scientist, can you help us? Because we've had one huge pandemic, and it is very frustrating not to learn more. And the public is fascinated by origins. I grew up with HIV, and the origins of HIV were just fascinating to people. It's in our DNA. Everyone wants to know about evolution and Darwin and these sorts of things. These are just intrinsic questions that people ask, and they're perfectly right, and therefore it would be good to get an answer, and we're being hindered in getting or trying to get answers. It's not scientific.
Dr. Simon Wain-Hobson and Dr. Amesh Adalja, thank you both very much for your contributions to the Nexus today. Much appreciated. Well, biological safety laboratories, or BSLs, that are used to carry out research are built to a very high standard, inspected by independent experts, and then inspected again by a country's official health and safety agency. There are 4 levels of security, the highest being BSL 4, but nothing is foolproof. Access to biological safety labs, or BSLs, is highly restricted. Only microbiologists with specific training and who have been tested in BSL conditions are admitted. Typically, BSL research labs are housed in secure buildings. Once past the building security, it's on to the second barrier, at the entrance of the laboratory suite itself. Security card, PIN number, iris scan or fingerprint, or some combination of these is needed. Then it's time to strip off and gown up. This can include wearing a full one-suit that is sometimes air-fed to ensure if there is a puncture, air leaks out, not into the suit. Walk on through an airlock and a second barrier and another security check. And then you're in the lab itself, and there it is, the glove box or isolator containing the pathogen. The glove box is held at negative pressure to the lab, and the lab held at negative pressure to the room outside. So if there is a leak, the air only flows one way, in. All labs are inspected regularly for even a pinhole-sized leak. So how can things go wrong? Through the air vents? Unlikely. All air passes through two H14 HEPA filters, 99.95% efficient, for particles down to 0.2 microns in size. Waste disposal? Also unlikely. All waste is disposed of directly from the laboratory into an autoclave, which sterilizes the waste by heating it up to 134 degrees Celsius under high pressure. It passes out of the autoclave and is usually incinerated on site. There is, of course, another way the virus may have escaped from the lab. It's what experts call a laboratory-acquired infection, or LAI. Somehow the scientist is infected inside the laboratory and essentially walks it out. So did the coronavirus that caused the last pandemic escape from a laboratory in Wuhan? The biological weapons expert Milton Leitenberg feels confident it did.
The most significant reason why it is a very plausible notion that a laboratory leak was responsible for the appearance of the virus is the information that has been obtained in the past year and a half, mostly by Freedom of Information requests. This has produced a mountain, tens of thousands of internal communications between the people responsible for doing the research, that is the Dr. Shi at the Wuhan Institute of Virology and her American collaborators. Secondly, also the communications between the people who attempted very early in 2020, at the end of January and beginning of February, to suppress the notion that it might have come from a laboratory. So we now have them talking to each other about suppressing it and why it's important to suppress the notion that it's a lab leak.
So you think it came from the Wuhan lab?
Of course. Of course. They said that they were going to make a composite virus themselves by molecular genetics out of 6 pieces. And lo and behold, the COVID-19 virus is made up of 6 pieces, which can be identified because of the enzyme that marks each of the 6 segments. When you take all that together, that's extremely suggestive that the laboratory did that, put it together, and then, unfortunately, they weren't planning on that, but there was what's called a laboratory-acquired infection. That's the fancy term, not laboratory escape, LAI, laboratory-acquired infection. They happen all the time. They happen in the very best laboratories in the world, in the United Kingdom, in the United States, and of course they happen in China too. And they happen all the time. And that was facilitated by the fact that the Wuhan Institute of Virology was doing this work under poor security conditions called BSL-2. They should have been doing it under BSL-3 plus or 4. When you put all that together, it's hard to have any other understanding other than the laboratory produced this virus and it unfortunately got out.
Well, we've been looking at the scientific preparations for disease X in the laboratory, but of course there's another strand to the preparations which will likely involve what we saw last time: vaccines, lockdowns, and travel passports. And to discuss this, I'm joined now by Dr. Tony Hinton, a former NHS surgeon and now independent consultant based in London. Tony, thank you for joining us once again. When you see the World Economic Forum talking about preparations for disease X and the World Health Organization leading it and so on. What concerns you most?
Well, I think what you have to ask yourself is, why is there now all this publicity around disease X? And there are a number of reasons. The World Health Organization at the moment is trying to change its international health regulations and have a new treaty with various countries, with all countries around the world. And it is for them to take complete control over not just the next pandemic, but any health emergency. And they can define that as widely as they like. And to just give you one example of how far that might go, there were stories this week of scientists suggesting that because of global warming, there could be viruses released from the permafrost in Siberia that would be a danger to humans. Now, there's no evidence that that is correct at all. Dr. Tedros, the head of the World Health Organization, has also been making claims that the next disease X could be 20 times more lethal than COVID. Well, he has no idea, because no one knows what disease X is, or if there will ever be a disease X. That's why it's called disease X. It is unknown. And one of the likely places it might perhaps come from is from a laboratory. Now, whether COVID came from a laboratory or whether it was a natural thing from an animal, I think isn't the most important point. The most important point is the reaction to COVID from governments around the world, which was a huge overreaction to something that turned out to be similar to flu. So the damage was done by lockdowns, lack of cancer treatment, vaccine mandates, vaccines which I believe weren't thoroughly tested. Those are the problems, not a worry about disease X itself. It's all political.
By saying that it was similar to the flu, there will be people at home throwing things at the television saying, what do you mean? It was an absolute terrifying pandemic that killed millions.
No, if you look at the infection and fatality rate, it was very similar to a normal flu, in the same sort of ballpark. And if let's look at UK care home deaths. Now, UK care home deaths, some will have been from COVID, some will have been from the flu, some were because patients that would have normally been sent to hospital if they got ill were not sent to hospital. Some, in fact, was because patients were just locked in their rooms and didn't get adequate hydration. They didn't get drinks. And so some patients in care homes actually died of dehydration. And on their death certificates, that they weren't certified by doctors, it was the manager in the care home that was allowed to certify those deaths as a COVID death without even a test.
Now, you mentioned that the World Health Organization was linking a possible future pandemic with climate change, and I've heard that too. What do you think might be their motivation for doing that? Are they looking for some leverage on being able to control, say, our carbon output in the future? What could happen?
Well, of course, every non-governmental organization, every huge conglomerate of people like the World Health Organization has a sort of a life of its own. It wants to expand. It wants to get more power. It wants to employ more people. It wants to have more say over what goes on in the world. And there are lots of situations like that. And if we look at what I would say their disastrous handling of COVID, first of all, they said it couldn't be transmitted person to person. Then they said no one needed to wear masks. Then they changed to everyone needed to wear masks. And if they had their way, if there was another pandemic, every country would have to follow the World Health Organization rules. Now, if we look around the world at the moment, there were a few countries that went their own way, if you like, and one of those was Sweden. Sweden did not lock down. They did not close all their schools. And they have the best excess death figures in the whole of the Western world. And that shows the way that we should be going, not lockdowns, not vaccine mandates. That was all about control. It wasn't anything to do with health. And if the World Health Organization had their way, we would not have the Swedish example to point to now, to say they did much better than almost every other country.
Dr. Tony Hinton, thanks so much. Appreciate it. And thank you at home and on your phones for watching. If you want to see this episode or any of our previous episodes, do go to our channel on YouTube. Just type in Nexus TRT World. Till next week then, goodbye.